Welcome to Med Talks with Medical Crib. It's never too early for detection. Today we will be talking about breast cancer, which is one of the common type of cancer. Let's know about the preventive measures and the treatment modules. Today I have with me Dr. Geeta Kadayaprath, who is a Senior Director, Breast Surgical Oncology. She's working with Max at Max Vaishali and Patparganj. Welcome, Dr. Geeta.
Thank you, Ansi, for having me here.
Cancer is one of the most prevalent disease among women, and we have seen the mortality has been increasing. So we'll find it out what is the reason that the mortality is increasing, or how can we prevent breast cancer? So, ma'am, what are the stages of breast cancer?
So, let me take your first question, which is how do you prevent breast cancer? So, there is nothing really that you can prevent, as in there is no vaccine against breast cancer, because whenever you talk about prevention, you think that there is a vaccine against the disease. So, a lot of times people confuse the cervical cancer vaccine as being effective against breast cancer, but as of today, there is no vaccine against breast cancer. The best bet against breast cancer is early detection. So, early detection is something that we all should aim for. I think we struggle there because even today in our country, about 60 to 70% of breast cancers are picked up in advanced stages. And that answers your question as to why is the mortality so high. So, in our country, the mortality is pretty high. But it tends to be seen as small considering that we are a big country with a large population. So, if you look at in terms of the numerator, we would possibly rank lower than a lot of other countries. But the fact is that in absolute numbers, we are pretty high in terms of mortality. So that brings me to this point of early detection, and that is we have to be aware. It is easy to say, screening mammograms to be done every year after the age of 50, but we do know that we do not have that kind of access to mammogram centers which can take care of screening mammograms on a regular basis. There is a cost associated with it, and considering that the incidence of breast cancer in India is much lower than what it is in the UK and the US, it is fair to say that it does not merit a regular screening program as well. So in that sense, so we have kind of, crossed the screening mammogram bit, in most of our discussions across the country. Screening mammogram does not find favor primarily for the reasons that I've outlined. So, what is your next best bet? One is, of course, that you can visit your breast surgeon. If there is no breast surgeon, then it can be a surgeon, or maybe even your gynecologist, because that is where you're very comfortable with, and you should subject yourself to a clinical examination every year, especially after the age of 40. You should go to the doctor once a year, get yourself examined, and also coming to the third bit, which is the breast self examination, because I think that is the weapon that you have in your hand. And learn it from your gynecologist or your surgeon as to what is the correct method of doing a breast self examination. So, for me, although if you look at Western literature, they will actually kind of, put breast self examination as not being very effective in bringing down the incidence. I'm not saying it brings down the incidence, but it definitely can pick up breast cancers at an earlier stage than later. So I would put a lot of emphasis on breast self examination.
when do a when do a person or a patient has to visit the surgeon, like you said? So what are the symptoms of breast cancer?
So, the symptoms of breast cancer most commonly is a lump, and it is a painless lump. The trouble is because it is painless, most of the people assume that it is going to go away, but it doesn't go away. And they just don't go to the doctor because it is not bothering them in any manner, it is just there. So they just think that let it be there, and it is possibly nothing, it is not hurting me, it is not doing anything to me, so why go to a doctor? So the key word is painless lump. So if you have a painless lump of recent origin, you should be going and seeing a surgeon. And I'm not saying that all lumps are malignant. That's a myth. So if you see 10 lumps, 8 lumps would be benign. And in younger women, especially the 20 to 40 age group, like I said, possibly 80 to 90% of lumps would be benign. But how do you establish that you're not that 10%? So to establish that you're not part of that 10%, you need to see a doctor and see that lump to its natural conclusion. By that, I mean you need to be imaged, you need to have a needle biopsy if there is a lump. And then, if it turns out to be benign, then you can sit back at home and say, well, I'm sorted. But if that is not the case, then you need to know more about the disease and treat you accordingly. So that's the commonest symptom. But other than that, you could be having a nipple discharge, which is spontaneous. Nipple discharge that is expressed is of not much value. And if the discharge is from multiple ducts, again, that is not of much value. So what is of value is a single duct discharge, which is spontaneous, and it is either bloody or it is clear. And it is coming in copious amount and is not going away. That could be a symptom of breast cancer. Then, your nipple getting pulled into your breast. Usually the nipple is out, but some people can have it as their normal because, when they're growing up in their 16s and 17s, in their teens, they would see that their nipple is not really coming out, it's staying inside. That's your normal. That's not what we're looking at. We're looking at nipple retraction, again, of recent origin. If there is any dimple on the breast, which becomes particularly prominent when you raise your arms, that could be a symptom of breast cancer. If there is a change in the skin, which takes the form of an orange peel, so you've got pits on your skin of the breast, that could be a symptom of breast cancer. And if in your armpit you notice that there is a lump which was not there before, I'm not talking about the excess bit of skin that hangs in the armpit, especially women who have breastfed and they suddenly see this ungainly, there is this tissue which is hanging in the breast, that is accessory breast. But if there is a standout lump, that needs to be investigated. So these are primarily the symptoms of breast cancer, which one needs to take seriously and has to be, taken care of by a surgeon.
You've already answered the question, like what are the screening methods? You also repeat it once more. What are the exact screening methods for breast cancer?
So, I've already said, yes, mammogram is a method where that is the earliest that you can possibly catch cancer, even before there is a lump. So, mammogram is recommended as a screening technique over the age of 40. But if you ask me, there's been a lot of talking on whether you should be doing it in the 40 to 50 age group. So there are two organizations in America, one which says over the age of 50 and the other which says over the age of 40 to do a screening mammogram. So I can quite understand why 40 to 50 is a tough nut to crack because your mammogram doesn't pick up much in dense breasts. So when I say dense breasts, young breasts are dense, which means the mammogram looks white and your tumor is also white. So white against white is no contrast and you can actually land up missing breast cancers in the 40 to 50 age group. But over the age of 50, you realize that the breast starts undergoing the changes of age and your breast tissue gets replaced by fat which looks gray. So a gray or black background against which if there is a tumor, you'll end up picking it up more easily, especially if there are microcalcifications. Microcalcifications are tiny calcium deposits which could be the earliest indication of breast cancer. So a mammogram can pick up these things. So that is one method. The second method, like I said, a clinical examination. I would like to dwell a bit more on the breast self-examination, which I think is what we as Indian women should do. All that you need to do for breast self-examination is spend 3 months on yourself once a month, and that's not asking too much. So what you need to do is, when should you be doing a breast self-examination? So if you're having your periods, 7 days after you start your periods is when you should be doing a breast self-examination. And if you've stopped having your periods, then Just fix a date. It could be the first of every month or a day which coincides with your birthday, whatever works for you. So that is when you should be doing a breast self examination. So all that it takes is 3 minutes. Three fingers. So let me just get my three fingers. Yeah. So the flat of your three fingers is what we're looking at. So don't poke your breasts. The tips of the fingers are very, very sensitive. So if you poke your breast, all the fat globules in your breast seem like lump. And you could be rushing to the doctor every now and then because it can create a lot of anxiety. So that's not the way to do it. The way to do it is the flat of your fingers. So when you suppose this is your breast, divide your breast into four, okay? And then use the flat of your fingers to run on the breast. And don't raise your hand. So don't do this bit and then jump to this bit because then you would be missing the intervening tissue. So rotate, press, slide. Rotate, press, slide. Rotate, press, slide. So you will go all around the breast like that, covering all the four bits of the breast that I told you about. Then go to the center where the nipple and areola complex is. A lot of times this area is missed because you think, if you've touched the breast, that's fine. And don't do a cursory examination. That's as good as not doing anything. Spend your mind, apply your mind to what you're doing. And once you're done with the nipple and areola bit, go to the lower part of the breast. The lower part of the breast is not visible. And your hand also doesn't go there because you can't see it. So you think you can jolly well give it a skip. But that skip can be quite detrimental because a lot of times you find tumors hiding in that area. So you have to do it diligently. So diligent is a very, very important word. Don't do it cursorily because a lot of times you say, I do exercise. So you ask them what kind of exercise. They say, well, I do yoga for 10 minutes. That's not exercise. So, doing exercise and doing it right for the right amount of time is very important to have the right kind of benefit. So the same goes for breast self-examination. Doing it right every single time, diligently every month. So what are we trying to achieve from all this? It is familiarity with your own breast. You could be having lumpy, bumpy breast. That's your normal breast. But how are you going to know that it is your normal breast? It is only when you go over it again and again. And if something unusual happens in the background of your lumpy, bumpy breast, you will be the first one to catch it and report to your doctor. So that is what is the aim of a breast self-examination. Quite simply, what we're trying to do is early detection, okay? So like I said, we can bring down a stage 4 to a stage 2, a stage 3 to a stage 1. That would be phenomenal success as far as our country is concerned. Because we don't want to see the stage 3s and 4s. Because that is where the trouble is. So your 60-70% of locally advanced breast cancers and metastatic breast cancers comes down to the other bracket, which is stage 1 and stage 2. So those are the 4 stages of breast cancer. So stage 1 and stage 2 qualify as early breast cancer. Stage 3 and stage 4 is advanced breast cancer. And of course, why do we want to know the stage? Because stage is what will determine the outcome. So stage 1 and 2, excellent outcomes. Stage 3 and 4, very poor outcomes. So it's as simple as that. And 3 minutes once in a month is not asking much at all.
Told us the how to prevent or how to early detect breast cancer. Now, if somebody has a breast cancer, so that's a fear, and that's something that everybody that's devastating, right? What are the treatment available, or what are the outcomes of it?
So the thing is, I understand the fear because I can't think of anybody, and it would be completely abnormal if somebody were to have a breast cancer and say, "Oh well, it's fine. I'm cool about it." It's not true. It is a difficult diagnosis to accept. So even after you're diagnosed with breast cancer, one tends to be in a denial mode for some time. And I don't grudge that to patients because I think everybody has their own method of reconciling with the diagnosis. They may go for a second opinion, they may get their slides reviewed, they may get a repeat biopsy done, they may get a repeat imaging done. So all of that we see all the time. But I think that is each one to one's own self. Once they're past that denial phase, that is when what you talk to them or what you say to them starts making sense to them. And one must understand that every person is unique, and the treatment that one person may get may not be quite similar to the other. So it is pointless trying to compare. You couldn't be saying that, my neighbor had breast cancer and she had surgery first, and why are you saying that I have to have chemotherapy first? So there is a reason to all of this. How treatment is assigned to you depends not just upon the size of your tumor, on the lymph nodal status, it also depends upon the biology of your tumor, because it is the biology of tumor which is going to tell us whether it's going to be chemotherapy or is it going to be targeted treatment. Are you going to require hormonal treatment? Is there going to be any need for radiation? So all of those bits will be determined by all that information that we try to pick up before offering treatment. So I always say that, don't jump into treatment. So when I see a patient, I know there are step 1, 2, and 3. The first step being diagnosis, the second step being trying to find out, has the disease gone to any other organ? By any other organ, I mean the lung, the liver, the bone, the abdomen, or the brain. So these are areas to which the disease may spread, and especially in a locally advanced situation, you want to get that information. So only after you've determined all of this, like I said, the diagnosis would involve a biopsy along with steps or investigation to find out what is the biology of your disease and to find out what the extent of disease. That is when we come to the third and final step, which is treatment. You cannot work the other way around, because there is so much of panic associated with this diagnosis. A lot of times you would see patients actually rushing into the treatment bit without stopping for these steps, which are so important, because that information that you get is of paramount importance, and you can't do a reverse. You can't go back and revisit things which should have been picked up earlier, because your best chance has already been forfeited, because you've had surgery, you've come back with a report which says breast cancer, you've had a lumpectomy, but your margins are all involved. So now I'm in a fix because I don't see how I am going to be able to conserve your breast, especially with that kind of background. So there is a mathematical method of managing disease, and that is how it is done. Like I said, the treatment would involve all of these depending upon the biology of tumor. Someone who's not hormone sensitive tumor will not get hormone treatment. Someone who does not express a certain protein, which we call the HER2 protein, will not require targeted treatment. Someone who is node positive will require radiation. Someone who's got a large tumor, more than 5 centimeters, will require radiation. Someone who's got a small tumor with a good biology will have surgeries first. Someone who's got a small or a big tumor with a bad biology will require chemotherapy first. So there are a whole lot of permutations and combinations that you have to work around. So it is decided from a case-to-case basis.
What is the final say to the audience out there on Breast Cancer Awareness Month?
So I would like to clarify a few myths that are associated with breast cancer, because I see a lot of patients. I mean, you do get this question every single day, especially, when you prescribe a biopsy to a patient, the patient would say, oh, I don't want to get a biopsy done because a biopsy will cause the disease to spread. So that's a huge myth. There are cancers in which we do not do a biopsy, like an ovarian cancer or a kidney cancer or even a liver cancer in which we're planning surgery. So, you would not put in a needle in those situations. But if it is breast cancer, it is of paramount importance for the reasons that I've already told you. Your treatment plan will depend completely on that biopsy report, and it does not cause the disease to spread. So just get this thing out of your mind. And the other myth is that if you don't have a family history of breast cancer, you will not get it. That's a huge myth, because you would find family history as part of somebody's breast cancer journey is just in about 15% of patients. So you only get 15% of patients who have a family history of breast cancer. 85% don't. So don't think that if you have a lump in the breast, I don't have a family history, I don't need to see a doctor. That doesn't work. You need to still see a doctor. And then the other myth that, it's only older women who get breast cancer. That's not true. Unfortunately, in our country, we're seeing a lot of women less than 40 years coming in with breast cancer. It is almost double what is happening in the West. So, under 40, the rates of breast cancer are close to 14% as compared to a 7% in the West. So I would say you should not, even if you're in your 20s, if you have a lump, please see to its natural conclusion. In all likelihood, it is benign, but please establish that it is benign before saying that, oh, it's a lump which has gone away. Because only today I saw a 31-year-old who knows that she's had a lump for the past 1.5 years, comes today with a lump which has replaced her entire breast. And she's still asking me the question, can I save my breast? Obviously not, because it is beyond that. So don't ignore any lump in the breast, irrespective of your age. Then the other myth is that men cannot get breast cancer. So 1% of breast cancers every year happens in men. So if men also were to discover a lump in the breast, please do not ignore it. And the fact that if you are at high risk, that you can't do anything about it, there are certain things that you can certainly do about it, because breast cancer happens because of a complex interplay between your genetics, your lifestyle, and your environment. So lifestyle and environment are two things that you can take care of, which essentially means eat the right kind of food, make sure that the food that you're eating is cleaned well so that you have very minimal amounts of pesticide in it. And also, like I said, alcohol is a no-no. Tobacco again is a no-no because there is an association, but I can't say that it is a causative. Exercise in your life is very, very important. At least 3 hours of exercise a week of moderate intensity. Moderate intensity essentially means if you go for a walk, don't go with your friend because you will end up talking and doing nothing. Go for a solo exercise. Go walking for about, do it half an hour every day, brisk walking. That is what is a recommendation. So there are things that you can change about you that will possibly prevent breast cancer from happening at all. And the biggest myth is that if you get breast cancer, you will die. That is not true anymore. So we have seen phenomenal amount of research which has happened in the last 20 years, and the results with breast cancer has changed so significantly that women, even with stage 4 breast cancers, are living to 7, 8, 10, 15 years. So which is amazing, amazing stuff that's happening. So don't run away from the diagnosis and don't think that if you get breast cancer, the outcome is going to be negative. It's become more like a chronic disease, like your hypertension and diabetes, which people live with forever. And even breast cancer in stage 4 can be a chronic disease. So my request to you is don't ignore your body, don't ignore yourself. Your health as women who are the pillars of your family is very, very important. And spend or spare those 3 to 4 minutes every month, and don't miss that opportunity to meet your doctor and get yourself examined. It's very, very important. It can save your life and also uh, make such a huge difference to all those who depend on you for their day-to-day living. So that is my message to you.
Thank you, Dr. Geeta, for joining us.
Thank